Those photos, if you've ever gotten to hug a patient like you hug that patient, you know what that true humanitarian love is. So Dr. Goldfeld's fusion of scientific discovery, clinical care, and humanitarian action has driven breakthroughs in TB, HIV treatment, and expanded access to life-saving care. NFID is proud to honor her with the 2025 Jimmy and Rosalynn Carter Humanitarian Award.
Thank you so much. Oops, I need my glasses. Thank you, Patsy. I would also like to sincerely thank the board of the National Foundation for Infectious Diseases and Dr. Gail Castle, who is a mentor and role model, who nominated me for this really wonderful honor. Thank you very much, all of you. To stand here in the presence of so many in this audience who have devoted their lives to the service of others, and to receive an award that carries the names of Jimmy and Rosalynn Carter, it is truly a humbling privilege. The Carters, who were two extraordinary humanitarians, taught the world through the way they lived their lives that compassion is not only a sentiment, it is a discipline. In office, Jimmy Carter chose peace over politics, bringing Egypt and Israel together at Camp David and showing the world that moral courage can redraw the map of history. And long before climate was a fashionable topic, he created the Department of Energy, set national efficiency standards, and even installed solar panels on the White House as a symbol of foresight. And President Carter put human rights as a standard into foreign policy. I remember well after the killing of the 4 churchwomen in El Salvador that he, even though he was already almost out of the presidency, halted aid to the military forces of El Salvador. Despite leaving the White House, President Carter never left public service. He decided to build rather than retire and founded the Carter Center, which has become one of the greatest engines of peace and health on earth. He launched global campaigns that have nearly eradicated guinea worm disease, which had millions of cases a year in 1986 when he started, and it's now almost eradicated. And they're on the path to ending river blindness in the world, having ended it in several Latin American countries. He championed human rights and free elections in more than 100 nations. Through Habitat for Humanity, he picked up a hammer and built homes with his own hands. And beside him, through it all, was Rosalynn, a force of nature in her own right, who made mental health and caregiving global priorities. She stood up for those whose pain is too often unseen. And as Jimmy said, Rosalynn was my equal partner in everything I accomplished. Together, they showed the world that the work of compassion never ends, it only changes form. Through their astounding 77 years of marriage, the Carters were unstoppable. They didn't accept that the world was as it was, and they challenged those who thought their goals were impossible. Together, they walked towards war zones, towards sickness, and towards injustice. As Jimmy Carter said, we can choose to alleviate suffering. We can choose to work together for peace. We can make these changes, and we must. This ideal that they championed of providing access to life-saving care and saving lives has also been a guiding principle of the Cambodian Health Committee and the Global Health Committee, the organizations I've been privileged to work with over the years. When my Cambodian colleague and I first began our work in Cambodia in 1994, the country was emerging from unimaginable trauma. Hospitals were hollow and devoid of life, and laboratories, once bustling with activity, lay silent. People had lost so much, hope seemed rationed. TB was rampant, with a national program only beginning to emerge after the Khmer Rouge genocide and the trade and aid embargo that blocked any kind of aid to Cambodia. Our work is grounded in the belief that all lives have equal value and that access to life-saving medicine is a basic human right. It is also based on the belief that everyone can take a difficult and long treatment if given the right support. Building on lessons treating TB in the active war zone of the refugee camps on the Thai-Cambodian border, where Cambodians fled after the Khmer Rouge genocide, Cambodian Health Committee began in 3 small hospitals in a region of Cambodia that had one of the highest prevalences of TB in the world. Working with the national program, Cambodian nurses, doctors, and the community, treating one patient at a time, the Cambodian Health Committee helped transform Cambodia from one of the most TB-plagued countries in the world to a global model for TB reduction. But as we and the country of Cambodia were making strides in TB, in the early 2000s, HIV and AIDS emerged in Cambodia. This has been linked by many to the trade in women across the borders of Thailand and Vietnam during the years of the tens of thousands of UN peacekeeping force members in the country during its first elections. And all of a sudden, hospitals filled once more, not with the wounded of war, but with men, women, and children battling HIV, and both HIV and tuberculosis. While the AIDS cocktail, or antiretroviral therapy, or ART, was widely available in the US and Europe at the time, there were no AIDS drugs in Cambodia. And for me, it was a nightmare that was revisiting me. As an ID fellow at Mass General, we saw the first wave of young men who had come back to Boston to die in their parents' homes, or who showed up in the hospital, and all the patients died because we had nothing to give them. And here we were in a position where there were drugs, but they were not accessible, because the AIDS drug cocktail had been already available since the late 90s in the US and Europe. And what we did was we began to work with the French Institut Pasteur du Cambodge, who we had met as we started to do basic science nested in our clinical cohorts to try to understand the immunopathogenesis of tuberculosis. The Institut Pasteur, or IPC, Institut Pasteur du Cambodge, had reopened its doors in the late 90s, having closed them during the Khmer Rouge. And indeed, the Pasteur's screening of the population for HIV infection made it difficult and then impossible to deny the magnitude of the problem in Cambodia, which many did, and argued against bringing AIDS drugs to the country. With seed money from the NIH, we brought together the Pasteur Institute, the French AIDS agency, Agence Nationale Recherche sur le Sida, ANRS, with the Cambodian Ministry of Health, and began to use science and partnership to test how to determine the optimal time to treat TB and HIV. And in so doing, we knew we would be able to provide AIDS drugs to 661 adults. Until then, patients who were co-infected with TB and HIV in the world, in general, finished 2 months of TB treatment before starting antiretrovirals, or the AIDS cocktail. And the reason for this is because, as you know, TB is 6 months, TB treatment's 6 months long, and in the first 2 months, a patient must take 4 of those drugs. And so there were many reasons why people said that people could not tolerate taking the AIDS drugs early, even though if you were immunosuppressed, 20% of the 100 who started the treatment would be dead within 2 months. They cited pill burden, they cited possible interactions between the AIDS drugs and the TB drugs, and they cited something called the TB-associated immune reconstitution syndrome, which is an inflammatory syndrome that occurs frequently in more frequently in patients who are immunosuppressed who then take AIDS drugs earlier than at 2 months after treatment start. So to jump to the end, this randomized controlled trial that was funded by the NIH and the French AIDS agency, ANRS, ended up proving that starting antiretroviral therapy early in a group of highly immunosuppressed patients resulted in a 34% reduction of mortality. So no changing, no new drugs, no discovery involved, except just optimizing the treatment schedule. And this was a finding that influenced WHO policy to recommend this approach. The trial also debunked several of the scientific biases that I mentioned, including pill burden. We found that patients could be could adhere very well to these multiple drugs. At the time, AIDS drugs were 3 times a day, and then the TB drugs. And what was interesting, though, is that we found that the inflammatory syndrome was actually a positive thing in the sense that it, first of all, did not dampen the advantage of early AIDS treatment, but it improved the immune response to TB. So this whole meshing of science and clinical care is something that we very much are going forward with and have found to be an important approach to synergize together, and has been very much dependent on NIH funding and funding from individuals such as Wallace Annenberg and John Moores. In our work, we've always believed that the measure of a program is in what we deliver and discover. We deliver care with what we have in our hands while we use science to find new solutions and treatments. In the field, that means treating patients today with the tools already in our hands, even as we build the evidence for better ones and better approaches for tomorrow. To act, innovate, and to never let the limits of the present stop us from creating a better future. And none of this, of course, I did alone. I work in a team, and I want to acknowledge the managers, nurses, community health workers, and physicians, and scientific collaborators who believe in data, and the ministries of health that have trusted us to innovate and work together and not to replace them. I'm deeply grateful to my colleagues at Cambodian Health Committee and Global Health Committee who do the work with their hands and hearts, and to the devoted individuals who have supported and stood beside us steadfastly, making the work possible, as does my wonderful son, Masafint, who is here with me tonight. I believe, as President Carter did, that the future will not be built by those who stand at podiums, but by those who kneel beside the sick. May we all have the strength to keep kneeling and never grow too tired to hope. And may we honor Jimmy and Rosalynn Carter, not with our applause, but with our actions. As Rosalynn Carter once said, there's nothing more important you can do than care for another person.